So now we'll move on to the Q&A portion of our panel, and I will restrict our panelists to no more than a minute each for these answers because we have limited time and everybody wants to hear from all of you. I'll start off with one for actually Dr. Owler, although you just sat down. I want to know, what do you do when people disagree with you, especially in extreme ways? I feel like that's a good question for you.
Yeah, that happens. And look, I mean, there are some people who will be completely against what you're trying to do, and certainly with the Victorian debate, that was a feature. It's not, you don't ignore them, you respectfully listen to the arguments. I mean, that is part of the democracy and the process that we go through. And I think it's important not to try and turn someone around 180 degrees. You could spend years doing that and never succeed. You work on the people that are undecided. That's where you concentrate your efforts. In any political process, that's where people are concentrating their efforts. And so I think it's about being respectful, listening to people's ideas. They're entitled to their opinion. You put forward yours. But I think sometimes you just need to work on people that are more likely to be open to what you're trying to argue.
Thanks. There's been a lot of conversation on Twitter. Everyone's been very grateful that you've all been working as advocates in different fields. Lots of questions and comments. I've got one here from Hugh. So Jazz really loved what you said, saying you have to make things personal, you have to explain why it matters to them. And Suki shared her own story, that once on a night shift, she read some cards for a 40-year-old man in ICU with esophageal varices. One read, "Dad, please stop drinking. I don't want to walk down the aisle alone." And it's still the most memorable thing she's experienced in medicine. Chris Richard wants to know, what do you see as the role of clinicians in regards to local climate policy and government advocacy? Any practical ideas on how we can advocate at a local level?
So yes, and thank you for the question. And in under 60 seconds, the local people, the local narrative won't be affected by the global narrative. So the one to go for is the co-benefits. To go for the things that damage the planet also damage direct health right now. So focus on those things, moving to active transport policies, which means that you get less road traffic accidents, you make it easier to cycle and walk, you make it more family friendly, you reduce the PM 2.5 concentration, so respiratory health improves, asthma emissions fall, and you push the health economic benefits. So go, if it's local, go for the local narrative that's personal, that affects people there, that will save money. And personally, I wouldn't be focusing on the big narrative of the climate change itself.
Great. This one is for Melinda. When you have heard at this conference the kind of challenges we've discussed, how do they compare with the kind of day-to-day challenges you face in Malawi?
We're human beings, and whichever environment that we find ourselves in, we'll face challenges. Probably the difference that as a professional, my challenges are different from all of us who are here and all other colleagues are facing in low and middle income countries, are how to get basic things to function. How do I make sure that I've got a glove to be able to practice what I know is infection prevention? By the way, will my theater be ready at the appropriate time? Will I have power to offer oxygen therapy to that patient that needs it? Or do we have the amount of money to sustain the oxygen budget? Because sometimes we don't have an oxygen plant yet, we've invested in that, but we actually get cylinders. So the relativity of the challenges probably goes beyond my professional training. And that's where the flexibility and understanding comes in.
That's really beautiful. I love that we've sort of gone through this journey and saw how, we can step up with Esther, how we can identify a need with Rob, how we can frame the issue with Hugh, the importance of being flexible, just as you said, Melinda, and also thinking more broadly, how we can engage with government, Brian. So, Rob, your talk generated a lot of debate and discussion, and a lot of the things you said resonated with people. They loved that you were talking about how we can break the cycle of retaliation and repeat offences by addressing those psychosocial determinants of health through community outreach. But one of the other things that you mentioned was that you were the only Black doctor that night. So there was a question, what do you think is the role of promoting more Black ethnic doctors and other healthcare providers to establish better rapport with at-risk communities?
This has actually been an area I've been working on since I was a medical student. Actually, even a pre-med student, making sure that we increase the number of students of color in specialties like emergency medicine or even just healthcare in general. It starts off with a simple thing. It starts off with mentorship. And the reason why mentorship becomes very important is because you need to have somebody who can tell you, wow, this is a really great idea for you to engage in, or wow, this is a not so great idea, or you can do it if you want, but it's going to take you a lot longer. And I think when patients, I think diversity is a very important thing in terms of healthcare delivery itself, particularly amongst practitioners, but you need to make sure that people are able to speak the same language and understand the same cultural practices of the population that you serve. When that doesn't happen, you get a lot of miscommunication, which leads to medical errors, which can lead to a compromised patient care and well-being.
Wonderful. I have one question that I actually want to hear all of you respond to. I realize that's not the most intelligent choice from a time perspective, but I really want to know how each of you sustains energy for your work. And we can start with Brian and work our way down.
I think most people that do advocacy are naturally driven to want to make things better. I think part of what we do as doctors is we see what happens, and that, I think, challenges us emotionally, and we want to try and do our best to change things. I think that's probably what is the core of the driving force. But I think also people that do advocacy tend to have a history of doing it, even back as a student. It doesn't mean you can't take it on later on, but I think there is a natural drive that a lot of people actually have to do this sort of work too.
I think the most important thing is to realize it's not a one-man show and that you're in a team and you've got a team that has one objective. Even if you differ in views, you're all seeking to improve healthcare. And whether I'm a nurse or a hospital attendant or a specialist, the reason we are still in the health system is because we have a passion for helping people who come with emergencies that threaten their livelihood. The other thing that I would suppose would also help sustain the energy is to step up and be more creative and innovative in how you can together deliver the appropriate care that will help a daughter see their mother for another day. Thank you.
Thank you. Hugh?
What sustains advocacy? Failure. If you failed, you have to keep trying. Anger, that you still haven't made the difference you wanted. And the people around you, who are generally the inspiring drivers.
I have two things. One is making sure that we develop a wellness practice, because we take on so many different stressors of not even just the people we work with, like our patients, but also our colleagues can be even stressful when we're dealing with them. And so you got to be mindful and kind of protecting yourself. Just be like, whoa, step back. But the other thing is the process of experimentation. You realize that the problems that we're going to tackle have been existing for sometimes centuries and thousands of, heck, in some cases even thousands of years when you start looking at violence and conflict, and realizing that it's not going to change overnight. So being diligent and trying and trying and trying. If it doesn't work, you try again. Really borrowing from like what engineering design process is, this cycle. What's the problem? Come up with ideas, brainstorm those ideas, implement a protocol, and then redo it again over and over again.
Fantastic. This one's for everyone as well. It comes from Say What Now. How do you balance the need for advocacy with the lack of protection for whistleblowers? For example, when there are negative consequences for standing up and speaking out, and we might go this direction.
Oh, me. I think when problems become personal, you don't really worry about whether or not you're, whistleblowers, because you're focused on the task at hand. And in some cases, you really have to develop a thick callus, but also tunnel vision to see the problem through. So you can't worry about naysayers.
Well, fortunately, I've never had to do that thing. I think the whistleblowers are brave. I think they need to be supported when they make those statements. I'd also say, though, that in whistleblowing or raising a problem, if you put it that way, I'd pick up on the point that was made from the political side. Bring people solutions as well as a problem. Don't just rage about the problem, but say, and now I would like you to do this. And that can help defuse that a little, I think.
Thank you. And bringing in solutions requires us to realize that we need to develop a skill set. And that skill set, like in my setting, requires you looking for mentorship and also collaborating with others who've been able to work in similar problems. These problems also exist in developed worlds. And we can harness each other's experiences and skill set to be able to actually achieve what we have been able to start.
Well, I think whistleblowing is really a very small subset of advocacy overall, but there are things like changes in workplaces, and particularly things in relation to bullying and harassment, where people who raise those issues need to be well supported and protected.
Okay, I think we'll move on to the rapid fire questions. So if you each could reach under your chairs and get out your big foam hands. These questions are all statements, and we've asked our panelists to indicate agreement or disagreement by the thumbs. So if you want to just show them thumbs up and then pivot for thumbs down, that's how we'll do this. So let's start with the first one. Politics get in the way of advocacy, yes or no?
Fair enough. There is a professional cost to advocacy.
You need an inspiring leader to help unite people in advocacy.
Some maybes?
We didn't have a maybe option. Now I see that we do. Do you want to qualify that any further?
I mean, you shouldn't always be looking for, the person to be the leader. I mean, sometimes it's about just forming alliances and groups. I don't think you need some leadership, but you don't need a leader per se.
How about this one? Most advocates are extroverts. Maybe for the people who voted down, what would you have to say about that?
I think some of us we can be introverts and extroverts at the same time. I think it just depends on the venue and how many people are in the audience, and you really see how much of an extrovert you are. But some people, when just listening to Esther and hearing her story, when Esther and I first met a number of years ago, very peaceful, but I had no idea that she had this firecracker spirit, and just over a period of time just watched her morph into this force, being an advocate for women's health and women's rights and healthcare as a whole. So I think you can start off introverted, but when the platform requires you, you step up to the plate.
Thank you. Next one. Is it everyone's right to break the law? In the course of advocacy? Well, I mean. Either of the no's want to qualify?
I think laws are made to help people exist in unity. They're not there to limit us, but they just give a way of how we can do things. It's how they're applied that actually is a barrier to progression. And I think as an advocate, it's important to realize that that can determine the type of influence you can have to be impactful in the change you want. So it's better to learn innovative ways of keeping the laws, to work towards your cause.
Thanks. So we've got to wrap up now. So just one sentence from each of you. Everyone in this room can be an effective advocate. How?
I think it starts with you have to start with figuring out what kind of problem do you want to solve and then move from there.
So picking up on that, why do you care? Find the thing that you care about and then try to convince other people that they should care in the same way.
I agree. Know your passion.
Yeah, harness your experiences, and I think everyone always argues for the best interests of their patients and their service.
I want to thank all of our advocates on stage, not just for their presence today, but for all they do in the world. Thank you.